وسيادة القانون. مجتمع قادر أيضا على حق المواطنين في المشاركة والتوزيع العادل في ضوء معايير الكفاءة وسيادة القانون. مجتمع يحفز فرص الحراك الاجتماعي المبني على القدرات ويوفر آليات الحماية من مخاطر الحياة.
There is also a great effort exerted to fulfill societal equality for all segments since 2014, and during the last 9 years in several files concerning citizens. That's why we will tackle in our session today. We will talk about two sectors of the most important.
لتحقيق العدالة الاجتماعية منذ عام 2014 وكيف تغلبت مصر على هذه التحديات أو تغلبت على بعضها حتى وقتنا الراهن. نرحب الآن معكم بالسادة الوزراء، السيد الوزير وزير الصحة والسكان الدكتور خالد عبد الغفار، والسيدة وزيرة التضامن الاجتماعي الدكتورة نيفين القباج. أهلا بكم. بداية، الارتقاء بصحة المواطن المصري من أبرز الملفات التي وضعت في أولويات الدولة المصرية من خلال مسارين. الأول هو إعادة البنية التحتية من خلال التجديد والإحلال في المؤسسات الصحية القائمة وإضافة أيضا مؤسسات جديدة. والثاني هو إطلاق حزمة من الإصلاحات الصحية العاجلة كالمبادرات الصحية تحت رعاية السيد رئيس الجمهورية والتي تعدت 20 مبادرة. نبدأ جلستنا بالتعرف على واقع هذا القطاع وكيف تغير خلال ال9 سنوات الماضية من خلال العرض التالي.
كل حاجة ممكن تتدبر إلا إن الصحة ما تتدبرش. هو الإنسان المريض مش بيتألم وبيتعذب، واحنا كدولة دورنا ان احنا نخفف عنه ما امكن. هنعمل مسح نشوف كل المصريين.
مفيش بلد تقدر تقوم وتصنع.
There is no country cannot protect and enhance the country without itself. During the last 9 years, we provided a comprehensive health care for our citizens. On top of our challenges was virus C, and Egypt was the greatest cases, and as well as diabetes, high blood pressure, heart problems, and they were waiting in lines to get treatment. That is worth £37 million. In 2014, we developed eliminating virus C program, and after success, we developed other programs that eliminate the roots of diseases. We refused surrendering to reality, and we protected our family, and we launched initiative, 1 million health initiative, that was able in less than 5 years to examine 92 million citizens, diagnose and treat millions citizens freely.
Egypt, where I met His Excellency President Abdel Fattah al-Sisi, who has demonstrated extraordinary leadership in the fight against hepatitis C. The campaign of his presidency called Meet Million Saha.
Under the acknowledgement of WHO, we know that the solutions have to be creative. We have launched many initiatives, implemented 1,135 to establish and develop and upgrade hospitals. On the other side, we invested in health sector from 3.7 billion in 2014 in about 7 doubling the number in 2023, and that was reflected in more than 4,000 center and clinic. Also, we have more than 53 centers for dialysis, and the cost of this reached to 55 million. And also we increased the allocation for medications to 14.6 billion pounds. In parallel with this, we localized industry of medications, and we have a medication city in Khartoum to fulfill self-sufficiency, and we were able to do that with 93%. We also exerted our effort to improve the cadres during the last 9 years to provide all the means to help them, and we increased the allowances of health cadres, and also program Egypt launched a comprehensive health care in Egypt, and we provided more than 28 million health services in 6 governorates. And we didn't forget the most needed citizens because the medical convoys are passing through Egypt during the year, along the year, and we were able to treat more than 3 million people, and we also launched the waiting list initiatives and started from 5,300 until it reached about 1,000,006 billion, and we were able to provide 1.7 million surgeries to our citizens. And on real test in 2020, with the spread of COVID, and Egypt was ready according to the healthcare development program to overcome this, and we localized the manufacturing of vaccines and Vaxera, and Egypt was the first in MENA to reach manufacturing the vaccine 100% by Egyptian hands. And we also provided more than 35 million services from examination and supply services. Here services are good, and it didn't take time to go through the process. Anytime we come, we can find doctors. Every case has a doctor. Treatment is always available in the pharmacy. All this was a result of work and development during the last 9 years, and our achievements. By our achievements, we wrote Tale of Nation. Dr. Khalid Abdel Ghaffar, we witnessed in the previous film the difference between the reality between health sector before 2014 and afterwards. Can we say by Egyptian numbers that Egypt is making steady steps to fulfill comprehensive health coverage for all citizens across Egypt? You only have 15 minutes to point out. He won't say anything like this. He won't be able to say anything. He won't say anything like this. Give him a chance, please. Yes, of course. Go ahead. In the name of God, the most merciful, the most compassionate, Excellency President Sisi of Egypt, actually thank you for giving me some time to demonstrate the tale of citizens with health ministry since 2014 to 2020, success failing, but serious attempts from my colleagues, whether ex-colleagues or current ones, and all employees in the health sector to try to improve our lives and our performance as much as we can within the available capabilities. It's a nation of citizens since they are born until they pass away, passing through many stages. No one on earth, and Egypt specifically, does not need treatment, and it does at its cost. And it might make people from being wealthy to being someone poor, and this is not what I'm saying. So how can we take care of our citizens in order not to move from being wealthy to being poor? The challenges were big since 14 until 2020. The form that you have, the picture you have on the right was the hospitals in Egypt since this, and we still have them. And we have about more than 700 hospitals that have been built since 101 years ago, but we exerted effort, and every time we upgrade or make a new project or change established hospital, we have a new code, a new path to direct or to lead our hospitals according to international and local standards for comprehensive health coverage. So challenges were were a lot. Most common one, which is very costly to every side. These or the numbers are not exaggerative numbers; they are real. That Egypt has made since within its capability since 2014 until 2023. But the lack of funding made a challenge. So we improve as a state to have by having initiatives to be able to detect diseases from early stages, to be able to treat it successfully with high successful rates. So one most important thing was not to deal with the patient, not just in hospital, but also we moved the health map differently, treating at state's cost. As we said, that not everyone is able to do so. As we saw with the president, even middle-income citizens, when they expose to surgery or to disease at the end, you won't be able to do it. And if they wanted to do, they had to get rid of necessary things in their lives, to have an open heart surgery or to treat tumors or something. Where is the state role on this? And this is one of the success we had as a state since 2014 until now. Of course, governors, health coverage, we always have health insurance since 63, 62, but we treat employees, not family. So health insurance was only dealing with a certain segment. So what about unemployed? And those who don't have income, what they are covered. So this is the difference between new comprehensive health coverage launched by President Sisi in 2019 to be insurance umbrella to treat all Egyptians at state cost, regardless of their work or income. And this is we had a conference stating that what was happening by population increasing is eating all resources, and as a health sector, the number of hospitals we have of the 50s won't be able, until now, won't be able to cover 105 million population. So the population issue is a very controlling issue in the health sector because of the needs required. So the weakness of distribution, services distribution, you can say that Upper Egypt has weakness, and if there was one of the top priorities we had in order to expand our health system and across Egypt, in every village, every center. COVID, the pandemic was a great challenge that hit Egypt and hit the health sectors globally the most. But during the past few days, our colleagues narrated COVID tale, and I'd like to say that again, when we went in the beginning of April 2020, and we told you how how the world was going through. Developed countries had failed health system, and because we didn't have a catalog to deal with this issue, and during through a committee to follow weekly with the Prime Minister. Maybe many of you doesn't know the behind scenes to deal with COVID, political, financial, materialistic support by President Sisi in order not to close the health system, in order to deal with it within our special circumstances, in order not to close industries in universities and end developmental plans. It was a difficult equation that pressed us. We changed hospitals to isolation hospitals. We dealt in within our capabilities and provided necessary vaccines to protect our citizens and reach more than 60% of vaccinated, fully vaccinated people as any developed country. These things we won't be able to do without have a political administration was following and directing Dr. Maid to meet our requirements from supplies, vaccines, bringing them immediately within a global economic crisis, but under the directives of President Sisi that did not save any effort or support that can save any Egyptian, and we were able to cross this hardship very successfully within our circumstances. So these problems, if I talked about the lack of funding, was the most impacting any health system across the world. At the beginning, there was £1 trillion were allocated from a state's budget since 2014 until now. This number, as President Sisi said, that the state was then the last 9 years, how much that will cost. This was only for health. And we have also many other sectors within the state, but we were able to have this amount to change the system from 32 billion pounds to 222 million. So the financial public budget we had was 42 billion, and we reached to 222 billion last year. So the increase is 24%. So if you saw this number, you can say that we are very successful. Where are the money? They went to first aid initiatives, health insurance, universities, hospital universities, convoys, vaccines. Again, health ministry deal with the child before they are born with initiatives for fetal and mother's health. Passing by the elderly, we have steps for all of them for treatment and follow-up. Those we use the £1 trillion for them. Maybe you can think that this is too much or great. So what are the standards that we can say that 43 billion or the 222 billion is good? We are one of them among the low or middle income countries. This is our category. Internationally, it is calculated upon the incomes, individual incomes. So this is our category. So we are, where are we within within the countries that are like us? So we, in 2020, we spent about $43 billion. So is this our dream? or do we want to be a part of the countries that we call upper middle class countries, that the individual and the GDP income is higher, and this is a strategic aim we have in 2030 agenda. And in order to fulfill this, there is countries are not very far, but they have financial capacities that spend about 2070 or 2080 dollars for individuals. That's why President Sisi tells us, give me money in order to an income to be able to spend on individuals, and this income has to be aligned with the neighboring circumstances. We will not we're not comparing ourselves to great or biggest countries with stable economy. So in the light of having this number of population, so the challenge is great. So the 222 billion pounds we say now is good. We may need to double it if you are reaching to North Africa. So we need to double it, to redouble it, in order to be equal to one of the countries that are not very far of us. If we have a dream to reach one of the upper income, middle income countries like Turkey, so 222 maybe is a number that that appears big, but this number is very humble comparing to the real needs. We need to improve health, citizens' health. So there's a difference between dream and reality. The reality is President Sisi was talking about during the past few days, and maybe we have the demograph here, and these are the income and spends, and we have the gap in between. So if our income is great, so that means that health system will take more, and that will reflect in health and the quality of health services provided. But we don't have except the idea, and President also has that limited capabilities. Countries don't have the great financial fund. Has to think in a different way. Has to be creative and effort and work in order to equalize the lack of capabilities with more effort. So President Sisi said this in our meeting today, and he said that it doesn't have anything but work and work and work in order to compensate the lack of capabilities. We have to pay. We are paying a bill for hundreds of years, and we have to deal with it. So the only solution is to think differently, and this was the tale of presidential initiatives that was presented from my colleagues on President Sisi on this support. It's a successful story praised by international institutions across the world. Egypt was called health diplomacy. So health diplomacy is how, as a state, was able to by certain measures to have a diplomatic model that can be stimulated across Egypt. The presidential initiatives, 14 initiatives, 92 million, 141 services with 32.2 billion pounds. Fast solution. Let's solve quickly fast problems on most common one. And this was an issue on top of our meeting, a ministerial meeting out there to narrate our initiatives for public health, and especially in hepatitis C. We are not the ones who are saying this. The idea compensated the weakness of capabilities. In Forbes magazine, why USA was able to eliminate hepatitis C as Egypt did. It's not what it's not our words. A country like the biggest economy of World said that Egypt was able in a very short time to eliminate hepatitis C. As how a country as USA to be able to provide this solution for their citizens who also have, of course, hepatitis C. So the success of hepatitis C, especially I won't be able to talk in all about initiatives. We will be able to examine 63 million population people. President Sisi didn't told us to continue. The examination we have in medical exam, we have in centers, universities, and working opportunities. We have lab centers, blood banks, and hospitals. People went there to be able to make sure that Egypt is presented to Golden Jubilee to announce Egypt clear of hepatitis C as a first country in world to be announced formally. That will happen during the upcoming few days by President Sisi hosting to WHO president, and this project was available since 2010 and 2015. But when President Sisi asked the former officials what they need, we brought the standards, the ideas, and we implemented how to treat many million of people or hepatitis or dialysis cases. So it was a very important tale that we needed to narrate. Because citizens after having 14% 14 people among 100 for hepatitis cases. So now we have the clearance certificate by treating those who were infected 20 or 30 years ago freely. The dialysis services from 2014 to 2023. Now and it is all at state cost. No one is having dialysis on their own, out of their pocket. So the first aid institutions, Egypt has 5,400 first aid center across Egypt. How to upgrade them in order to be available in beside every citizen, and ease the burden for citizens to receive the first or primary care services. And we had this with a cost of 16 billion pounds, and we're still upgrading. We are developing a project with 255 center. We are reaching by the end of this year up to 850, and this prepares Egypt to comprehensive health coverage. And President Sisi, we want you to expand this initiative in order to be able to fulfill or to complete our success. And we have about 1,050 services, and would like to continue on it. This is an idea that has capabilities, but its effect on ground is great, and we are witnessing it. A big project when President Sisi asked us about plasma and how much do we pay. Plasma is surveillance that is inserted in very complicated treatments for diseases, and why can't we have self-sufficiency? So who in the world can cooperate with us? We found the best experts with Reveals in Spain, which is #1 on working on blood dividends, $300 million. Can I say, can you allow me to narrate this story? In the name of God, the most merciful, the most compassionate, with the Minister of Defense, we thought about this project. And Egypt thought about it, but it didn't work. And over the last period, we were talking about the ministry's board meeting now. We said that put the aim and turn and keep turning around it until you implement it. This issue was since 2012, and we are trying to present this project to light. At that time, all global companies, reputable names that can be used, did not cooperate with us. Did not cooperate with us and we are still insisted to call here and there and have discussions and provide everything, but in order to have this project based on basis that was established on to have a cooperation under the name of the global company, to have it in all process, through the all process, to have the full authenticity to that we are working with. Until 2019 maybe, or 20, we weren't able to do it. We weren't able to do it, Dr. Khaled. Why? But it doesn't matter, but this is what happened. But we were insisted to do it. Until COVID, with its repercussions, so it made a change. What did it make, Dr. Mustafa? A change in thought, global thought. In regards to this, so the chance is available. So when you find global changes across the world, not miss the chance to seize advantage of it. So in this time, we saw that people were forming a different map, and we were ready to work with a state like Egypt, and we had the agreement. Maybe we wanted to have the factory within in 24 or 25 or maybe 26, in the beginning of 26, isn't it? But this factory will be working here in our country. And I'd like to say a very important thing, Khaled. I considered this was a part of recorrecting Egyptian habits, that we were able to have it a national factory to produce plasma, because the standards used in admitting specimen are very restricted. So I established a center in any university. So all youth in universities, if you are wanted to volunteer in the center, so they have to maintain the path, the health path and health habits. What will it be? They have to maintain it, because any deficiency won't be accepted and won't to be improved. So there is something in turn, and I also benefit, and I always benefit from this. Today's the volunteers' income as an appreciation from centers. If he's going to volunteer once a week, how much it would be a month? You don't want to say? Okay. What about 2 times? Okay, you don't want to say, so it's respectable number. So it can, many can apply, millions can apply in Egypt. So this was my dream, to have millions. So I was then able to provide income from an idea that improves people's health and allow me to produce other dividends from plasma to by Egyptians manufacturing that will be our plasma, impacting our public health for people because it will be a path, a respectable health path. This is the story of plasma. We had established 8 centers until now, 8, and we are targeting 20. 20 in this phase, 20 and 50 and 100. Yes, Khaled? Yes, sir. So you will see standards of developed countries, how they deal the health sector. Am I saying I'm speaking appropriately? So you will see health, how they deal with health system that we will learn a lot from, because it is approved by Spanish company, and it is very strictly and accurately and precisely supervised, that as habitual in Egypt, we don't care that much about it. So I'm not taking the mic away from you. So you said that we need 3.1 billion. You're talking about middle income individuals. You're not talking about high middle income countries. So we're talking about, if you are saying if you want 105 million, you want 3 or 5 or 4 trillion pounds. So that would be able to do it now, have it now. So I'm talking about people who are going to hospitals that don't like. And they're asking about where the country is. So we need to work day and night, because until now the country doesn't have it, but by working day and night we can do so. Thank you, Khalid. But every pound spent in initiatives, as we see 14 initiatives providing for state economy, every pound is spending in the beginning of a disease or a disease that did not occur yet. It saves a lot, as breast cancer, for example. Specifically for women, we were able to detect it very late in 4th stage, so the treatment was difficult and very costly, even at families or states or insurance capacity. But we have 18 or 20 year old girls. We were able to examine them, and we were able to detect the disease early. And instead of having 72 late discoveries, we are now having 29 late discoveries only. Please don't pass through our, go briefly. Please deliver the number, deliver the idea. You're saying that 29% and you're satisfied. We are not. Why are you satisfied with this number? So if we are teaching people how to self-exam, so whether by frequent examination or teaching our daughters to take care of this. Why? In order not to be injured, not to be self-injured and mentally hurt. So if we know it very early, the cost, we're not talking about the cost, we're talking about the impact. So we have a chance to demonstrate, because 29 is a big number. 29 that you are seeing out of the 70 growth, we can make it 0 from today. Instead of asking people, I think that I do hope that people do not take it in a bad way, but instead of repeatedly saying kitchen, and I haven't seen any program talking about health habits contribute in this. So if you are saying about taking 50 because maybe people are listening to us right now, because they can say that to do this and to do that, and before marriage do that, in order, not because we are not able to treat, but because we are, those who are hurt, those who are harmed, are in pain, are suffering, and we don't want anyone to be in pain. Not only this, sir, I'd like to remind you when you directed us with early self-detect exam or exam for going to be married. So the exam, it's not our invention. It's a model that we can, by which detect genetic diseases or genetic can impact their marriage. We are not interfering in marriage, but we're telling them, showing them situation, whether disease, genetic, and the percentage of their diseases, or even infections. So it is an initiative that was able to let us discover. When we have the confirmed cases, we put them through the path of treatment. So no one would be able to marry without being reassured in their health. So we're directing them to the right path, whether having chronic or genetic or infectious diseases. So this is the path adopted by control. When we have early exam of tumor diseases that were launched in 9 governorates in last January, to early examination of lung and colon, prostate, and cervix tumors. We were able to have scans in order to implement success, and the aim wasn't able to reach 30% success. So any health official wish by this initiatives want to reach breaking records numbers. But at the beginning of harvesting the initiative, we will be able to reach President Sisi aspiration to reach every woman and girl in Egypt paid attention to all what we served, and we provide services from mobile clinics. Any woman can benefit from these services, can protect herself and her family from many harms that may result to this disease. This applied to anemia and chronic diseases. We are able to reach about 8 million people, treating them from anemia or obesity. These are initiatives. Again, we are not treating citizens who go to hospitals. We knock the doors of villages, schools, and we go pass by homes to ask them to join us in our program in order to have 1 million health. All of them are healthy, and I imagine that this is what you're talking about. This is our story, to be concerned with citizens' health. This has not happened before 2014, not because of lack of capabilities, but the supportive idea that were made by my former colleagues. We have a dream and future vision. We'd like to upgrade services, reduce the amount of mental, intellectual, and hearing and hearing impairments. So our vision, according to National Strategy for Health and Population Ministry, launched in the meeting, and President Sisi honored us. We had this initiative, and I reassured you, Mr. President, that we're talking about the population issue, and we will activate the implementive steps from the plan to enhance, to boost all the country to work with this issue, because it's not just a health issue, it's a state issue, to prioritize this matter in order to overcome it, to have it in line with growth and development. So all initiatives and future visions in these initiatives were very important. One important thing, you are following it up daily and monthly, and the support is extraordinary, with waiting lists and treatment at States Coast. The Guardians posted in their newspaper stating that the waiting list, there was a short, because there is a great taxes in this regard. So the country is suffering from a very long waiting list. Maybe a temporary heart surgery patient can wait 6 months. So we're talking about the United Kingdom here. An initiative from 2018 launched by President Sisi. I don't want to say eliminating waiting lists, because it won't be eliminated, and President Sisi has a story. So the demonstration, so the beginning was something, and now we have 1 million and 1.7 surgeries with 15.8 billion pounds since 18 until now. So it's not a very long time ago, and the return is very great. And the waiting list with the heart problem patients needing catheter surgery or surgical intervention in cochlear or cardiovascular surgery, how much do they wait? And the follow-up is reducing the waiting list, and we reached before the previous crisis with 3 or 4 weeks maximum, and we always have a financial crisis with President Sisi. And when we talk with them, because I'm one of the people trying to get the largest gains possible for work and for the President Sisi generosity. No, it's not about generosity. This is people's right and work people. And like I know that the budget has limits, and what I brought from a pocket, a fund like Tahya Masr fund and Suez Canal as well, President. Yes, I will say this. I'd like to clarify that this is our chance now to explain to people why do we are keen on having funds, gathering money, invested, and the return overs is used to one of the projects that you offered me a few months ago that needs 1 billion, and we said that we use Suez Canal Authority fund. So these are ideas. If you are giving, if I gave them all the money to Dr. Mait, he will need maybe more than this, 10 times more than this. What I give to him will be nothing. So the whole idea, Dr. Khaled, and I'm explaining to people listening to me now, I've never talked about this fund and told people if you want to present something to your country, this fund makes a lot, very important roles. We're not talking about it, we don't talk about it a lot. But if we needed anything urgently, we withdraw 1 or 2 billion pounds from the fund, and they are on direct under supervision of me. So let's move to treatment at state cost. So the citizen, even poor citizens or even willing citizens, capable citizens, if they are told they need urgent surgery, so if they are asked whether they have insurance or not, they say no. Even if diseases will not very interfere in checking their work or income, although we have a data base to confirm that the monies go to the most needed. In 2023, we have 3.5 decisions made. The beneficiaries are 17.5 million patients. The cost was 86.10 billion from 2014 until now. So we're talking about more than the double. This is logical with an increased population country and with the average life was increasing due to upgrading services. So we have increased the average life has increased. So from time to another, we're suffering from the allocations coming to. I'd like to mention an important thing in here. I'd like to confirm the governor of central bank, because he put the health as a priority even within the current crisis, on top of the priorities of Egypt. Because this is I need to say, because we are here to we are meeting periodically under the authority, but I don't want to say the number, because you won't believe how they committed by the central bank to dollars. Even when we're talking about loans or from monetary fund, the number is can be is spent in 2 or 3 months only in our sector, in order not to make any patient needs a stent or catheter or treatment for tumor. The central bank meets with us weekly to fulfill under the directive of the ministerial board. But within this crisis, thanks God, we are working, our surgeries are going on and hospitals are going on. But what we see now, the number might be simple, but around 70% of any surgical process is done according to hard currency. We are not producing in this field a lot, especially other than medications. We have self-efficiency, but other than that, we have it's all important with hard currency. So providing the currency in appropriate time, because we want, so the heart institution won't be able to stop for a day, or this hospital need require a stent. We cannot tell them that we don't have the right size. So the committee provided by a ministerial board with all concerned parties to meet weekly to see the needs of countries. So even automating hospitals since 2014 until now, we have the decision 24 hours in elective cases, but any emergency, any patient heading to hospital or university or hospital or insurance. So we have the process. We don't ask them to wait. We made the procedures, and we have automated decisions with exams. Not personally, we can issue a decision within 24 hours. Leadership governor since 2013, Health Ministry was providing services and supervising itself, buying medications and have the beds and everything globally. Nothing has, it's nothing, it doesn't work like this globally. So that's why we had, since 2014 until now, in the last 40 years, the health and health insurance coverage and medications authority, 6 independent authorities, but not separated. But at the end, they are providing for health ministry, as they are concerned to coordinate with among all these authorities for procurement. So this is one that approve authority of food safety, supervising everything that is related to food, and this is a global change in the system of governance and health system across the world. We didn't have this before 14. That's not true. This is not easy. We need budget, parliament, members meetings, but heading to 2031 we cannot have a number of these beds in hospitals. We have to empower private sector. We have to give them competitive chances to help a state in establishing health institutions able to contribute from a caregiver to a care supervising. Participating in the service, it's okay, but not to have all the burden coming from governmental institutions. The old health insurance, in 2014 we had 44 beneficiaries. Now we are talking about 69 beneficiaries is covered by health insurance authority. The cost is 6.7. Now we're talking about 45 billion pounds yearly for the 70 million. So anyone has a health insurance card. I'm not talking about new comprehensive health insurance in 6 governorates. I'm talking about any employee, not their families. And this is the difference between what was done since 2014. As President Sisi said, we had to have comprehensive participation, that all the members, all the family has to be covered, and this is the difference. The cost is 189 billion within the last few years, and that's why we're saying the numbers in our sector is shocking a bit. This is the difference between the system in 2014 and 2023. The nearest was the new capital administration we're talking from is providing and preparing the first comprehensive hospital. As we're talking, this is a very nearby hospital for run by health insurance efficiency, and there was contraction for another hospital. This is just what the health sector is doing in the capital, new capital, to show what we are doing to prepare or to provide for this place. So the dream is the first phase of comprehensive insurance. We have 3 authorities. That is 6 governorates, 6 million citizens, 28 million services up till now, with a cost of 51.1 billion. I was talking with Dr. Maid in the morning and asked them how much we will cost until we complete your direct, after 10 years from now, to cover all the governorates, because he's an expert in health insurance. He told us that we are heading about 571 billion in 2030. Around 2030, that would be the cost. Talking about the treatment cost and not the establishment, building the hospitals and preparing the hospitals, about 1.5 billion with 200 beds. Adding preparations, and we're talking about a 2 billion pound hospital. Now we're talking about medical services, so the financial cost to expand in health insurance in the upcoming period. So 362 center, 13 approved hospital. Up till now, we had many very accepted success to launch the second phase in 25, 26 and 24, 25, 26, and we had complete studies according to presidency directives to have it in upper Egypt, and one of the biggest governorates in lower Egypt in order to expand. The coming is easiest because we have the system stable in 6 governorates, and this is the health system before and after institutions. I'd like to stop here. 126,000 beds. Now we have this number, but some studies shows that 132,000 beds. And actually we are reducing because population is increasing. We're talking about 1-2 million bed for 1,000, for every 1,000 citizens. So the global percentage is 3,000. And we are less than global rates because we are increasing with a very more rapid population than building a hospital and entering beds. So in 2025 we'll have 112 population, that according to projections from Statistics Authority. So while planning, we have to consider the number of population and the number of beds. We have to increase the beds to bridge the gap resulting from population increase. In conclusion, I'd like to increase beds in 25 to add 7,000. 2013 we need 17,000 beds. 17,000 beds cost about 76 billion pounds. So I'd like to have to tell the state right now, because of the new health insurance, because I have 700 and something hospitals with 132,000 beds. I need to add until 2030. I need to add 17,000 beds with calculation. Otherwise, I'll talk about hospitals and numbers of hospitals. And although, despite the increase, and this has happened in Asian countries, there was a very intensity in COVID there. We don't want to do this. That's why we are working since 2014 up till now, from 2018 up till now, in more than 1,035 projects with 98.5 billion pounds. Now we're talking about architecture, seeing governorates. I saw Suhaq, Qina, Monofia, Daqahliya, Alexandria. I have to expand our system, whether upgrading or no projects, but all of these projects are across Egypt by President Sisi directives, in order not to focus on one governorate, to have several studies and the needs of the hospitals, and to study all of this with a new institution. If we are not able to qualify with new standards or upgraded, can be approved or accredited to service health sector. A great part of our sector work day and night across Egypt. Are all people pleased from us? And we have the parliament members in relation with me, in touch with me every day. At the end, we cannot do everything. We don't have the capabilities to do everything. We just have priorities. That makes us have priorities. Every governor has the priorities of its governor, but we see the whole picture. We say that this need, that because there are 3.1 million and we don't have health service, we need to increase it. But this is the form of infrastructure working on in Suez, medical Suez complex. We go to Qantara, Ena, Sohag, Aswan, and every governorate in Egypt has 2 and 3 projects in order to upgrade. Not only this, but he asked us to have immense medical cities, to be a backbone or focus places in every governorate or region, if we are able to do so. And aligned with the Nareen Medical Center to upgrade Nasser institution. So we are talking, we are going through the project by the supervision of local and international contracting companies. So is that would serve only Cairo, or across Egypt? Nasser's institution is not only approving, servicing Qahira or Great Cairo or Giza only, but they provide for all. We're talking about 37 Faddan over Nile in a very intelligent area in order to complete this project and change it from just a big hospital to a comprehensive medical city. And I'm asking this number or the idea from you, President Sisi, and this the idea actually the initial cost is 8 billion, and it can be reached to 15 and 20. And I know that we have a problem because we are having big dreams. Would then as a member of government within our capabilities that we work and exert effort in order to change our reality that may be difficult, and we are all not satisfied with future projects with the 97 billion pounds that we approved recently or in the future. We have the map and the cost and the pattern that accredited or approved by presidents, but actually we're working on medical convoys and upgrading with 1.7 billion to reach places that we don't with Haya Karima or Decent Life initiative, because it's a very important sector. So 55 billion pounds in health center for governorates in the first phase of Haya Karima. Population and family organizing. We worked with this positively, and we were able to achieve to 8.2 rates as in 2014 we have 14.2. That's the delivery rate. We would like to break 1.6 or 1.8 in order to have the development growth in parallel with the population increase. COVID costed us buying vaccines and even medical technology. The number of factories, medications increased from 130 to 140, from 500 to 700 production lines, and even medicine production. Companies were able to stand with the state. We are improving the basic the data system in order to have automation across the country. We were talking about higher education, ministry, and all sectors and institutions. Fundamentally, we are upgrading in a first aid or ambulance authority in order to connect it to the network and to have a waiting time of minutes for an ambulance to arrive and go to the nearest or to the connected point for the patient in order to have what we had made in the new capital administration. We had a digital transformation. We did not leave people because but the human factor is very important. We have a problem with that. As President Sisi always say, to study how we look turn that human factor receive. So that's why we are working to compensate human factors, not only doctor, nursing and everything. We're training them. We have a new health council in order to enhance them. We are increasing the numbers of comprehensive insurance number. We have medical cities. This is our future cities in health sector to increase the beds number in aligning with the population increase. This was the story of our health ministry, or citizens' story with health ministry, if we were able to say that we to put ourselves as a chapter in nation tale written by sweat and effort and